Masturbation is one of the most natural and widespread sexual activities across the globe. While it remains a taboo topic in some cultures, science has taken a deep dive into its health implications, especially for men. One question that frequently arises is, what happens to your prostate when you masturbate daily? Is it beneficial, harmful, or neutral? In this comprehensive article, we'll uncover the latest scientific research, medical insights, and surprising truths about daily masturbation and its impact on prostate health. From hormonal changes to cancer risk reduction, and from psychological well-being to potential overuse concerns, we'll break it all down in clear, straightforward language, understanding the prostate, the male powerhouse. The prostate is a small, walnut-sized gland located just below the bladder in men. It plays a crucial role in the male reproductive system by producing seminal fluid, which nourishes and transports sperm. Key functions of the prostate include producing seminal fluid that mixes with sperm, controlling urine flow through the urethra, supporting ejaculation. Over time, especially as men age, the prostate becomes more susceptible to various conditions, including prostatitis, benign prostatic hyperplasia, BPH, and prostate cancer. Hence, understanding how daily behaviors, like masturbation, affect this gland is vital for long-term health. Masturbation, a natural habit with biological purpose. Masturbation involves self-stimulation of the genitals for sexual pleasure. Most men begin the practice during adolescence and continue into adulthood. Studies suggest that up to 95% of men masturbate, and a significant percentage do so regularly, even daily. Biologically, masturbation serves a few key purposes. Relieves sexual tension. Reduces stress and promotes relaxation. Flushes out old sperm and seminal fluid. Improves sleep through the release of dopamine and oxytocin. But how does this connect to prostate health? Let's dive deeper. Ejaculation frequency and prostate health, what the science says. Several studies have shown that frequent ejaculation may reduce the risk of prostate cancer. One of the most famous studies published in the journal European Urology in 2016 found this suggests that daily masturbation could be a preventive factor against one of the most common male cancers. Researchers believe this benefit comes from the regular clearing of toxins, old cells, and waste products from the prostate. One major myth surrounding masturbation is that it lowers testosterone levels. However, this is not entirely accurate. Acute effects: right after ejaculation, testosterone may slightly dip. Long-term, there is no evidence that daily masturbation significantly lowers overall testosterone levels. In fact, regular ejaculation can help maintain hormonal balance, especially in younger and middle-aged men. A healthy prostate function is deeply tied to stable hormone levels, and masturbation might play a role in that regulate. Prostatitis refers to inflammation of the prostate gland, often caused by bacterial infections or poor drainage of fluids. Regular ejaculation through masturbation can help flush bacteria and harmful substances from the urethra, reduce the stagnation of seminal fluid, which can prevent inflammation. Keep the ejaculatory ducts active, reducing the risk of blockages. In other words, masturbation can act as a cleansing mechanism for the prostate, blood flow, oxygenation, and tissue health. Daily sexual activity, including masturbation, increases blood flow to the pelvic region. This promotes oxygenation of prostate tissues. Nutrient delivery. Removal of metabolic waste. Improved circulation can keep the prostate healthy, reduce the risk of fibrotic changes, and maintain the elasticity and function of surrounding tissues. Psychological health and prostate wellness. While we often focus on the physical, it's important to consider the psychological benefits of masturbation. Reduces anxiety and stress, both of which negatively impact prostate health. Improves sleep. Better sleep promotes healing and hormonal regulation. Increases dopamine and endorphins, improving mood and mental balance. A healthy mind supports a healthy body, including the prostate. The downsides: when daily masturbation becomes a problem. While daily masturbation has many benefits, there are potential downsides if it's done excessively or compulsively. Pelvic tension syndrome. Overuse may lead to chronic pelvic pain. Reduced sensitivity. Constant stimulation can desensitize nerve endings. Interference with daily life, if it affects work, relationships, or social behavior, it may signal a behavioral addiction. Importantly, these issues are usually behavioral, not physical, but they can indirectly affect prostate health through stress and inflammation. Age matters. Young men versus older men, the effects of daily masturbation on prostate health can vary by age. Young men, 18 to 35. Frequent ejaculation supports prostate drainage and hormone balance. Middle-aged men, 35 to 55. Regular stimulation may help prevent enlargement or inflammation. Older men and masturbation can help with prostate stiffness and maintain urinary flow, but frequency might naturally decline. Regardless of age, the goal is balance and mindfulness, not forced routines. Myths busted, separating fact from fiction. Let's clear up some common myths. Masturbation causes prostate cancer. False. It may actually reduce the risk. Daily masturbation weakens you. Not if you're eating, sleeping, and exercising well. It lowers sperm count permanently. Ejaculation may reduce sperm temporarily, but levels restore quickly. Masturbation damages the prostate. Only excessive, aggressive, or compulsive behavior poses a minor risk. Science supports moderation, not fear. So, what happens to your prostate when you masturbate every day? In most cases, it gets healthier. You reduce your risk of prostate cancer, promote fluid drainage, maintain tissue elasticity, and support hormonal balance. The key is being mindful, not obsessive. Like all things related to health, consistency, moderation, and awareness are what truly matter. If you enjoy daily masturbation and it isn't interfering with your life, relationships, or mental health, then the evidence strongly suggests you may be doing your prostate a big favor. Medical professionals increasingly acknowledge the benefits of regular ejaculation for men's prostate health. Here's what some experts have said. Dr. Michael Leitzman, MD, Harvard Medical School. Frequent ejaculation, whether through sex or masturbation, may have a protective effect on the prostate by clearing out carcinogens. Dr. Tobias Klate, urologist, Berlin. Regular prostate stimulation through ejaculation helps in reducing the chances of fluid buildup and inflammation, particularly in aging men. These statements align with various long-term studies that demonstrate a lower incidence of prostate problems among men who ejaculate more frequently. How masturbation influences seminal fluid and prostate pressure. The prostate doesn't just secrete fluid, it holds pressure. Without regular ejaculation, pressure can build up, leading to discomfort, congestion, or even a dull ache in the perineum or testicles. Regular release can normalize internal pressure, prevent fluid retention, reduce the risk of prostatic congestion or calcification. This is especially true for men who are not sexually active with a partner. Masturbation, prostate massage, and sexual fitness. Prostate massage is a practice where the gland is manually stimulated, either externally or internally, for health or pleasure. Surprisingly, masturbation can act as a light, indirect prostate massage. Benefits include improving gland elasticity, supporting erectile function, boosting libido over time. Men who masturbate regularly often report greater sexual confidence and stamina. Prostate drainage and detox, a controversial but growing idea. Some alternative health practitioners argue that regular ejaculation helps detox the male reproductive system. Though detox is a vague term in medical science, there's truth in the fact that ejaculation removes aged sperm, clears dead cells from seminal fluid, flushes out harmful bacteria that may linger in the urethra or ducts. This cleanse effect helps reduce the risk of infection and inflammation. How to masturbate safely for prostate health. While masturbation is generally safe, here are tips to ensure it's actually beneficial to your prostate. Avoid aggressive strokes or high-pressure grips. These can irritate nerves and blood vessels. Use lubrication. Reduces friction, protects skin, and enhances. Can I masturbate every day without damaging my prostate? A. Yes. For most men, daily masturbation is safe and may improve prostate health. Question: does masturbation prevent prostate cancer? A. It may reduce the risk, especially if done regularly, 21 plus times per month. Question: can too much masturbation cause prostate pain? A. Rarely. Overstimulation or lack of recovery time can irritate the pelvic region, so moderation is key. Question: should older men still masturbate? A. Yes, as long as it's comfortable and not forced. It helps maintain flow and reduce congestion. Thoughts: embrace your sexual health without shame. Society often treats male sexuality with silence or stigma. But the truth is, your sexual habits directly affect your health, and masturbation is nothing to be ashamed of. In fact, when done mindfully and in moderation, it is a powerful tool for wellness. A way to prevent serious prostate issues. A method to stay in tune with your body. Your prostate is a vital organ. Treat it well. Listen to it. And if daily masturbation makes you feel better, helps you sleep, reduces stress, and lowers disease risk, then continue with confidence.